Hello. I'd like to extend a warm welcome to the National Coalition of 100 Black Women Metropolitan Atlanta Chapter, our sponsor, Eli Lilly and Company, and to all of you who are viewing this program this evening. My name is Azizi Blissett, and I'm Account Director at Black Health Matters. Black Health Matters is the leading health, wellness, and chronic disease digital platform dedicated to improving health outcomes among African Americans. Rooted in Black communities, our mission is to improve health literacy, which includes addressing health care, health policy, health equity, and health disparities for positive outcomes. For more information, go to www.blackhealthmatters.com. This month is nationally recognized as Blood Cancer Awareness Month. So today, it is our pleasure to bring this informative session to you. You will hear from hematologist Dr. Ashley Woods and blood cancer survivor and patient ambassador, Leya Elijah.
Good evening, everybody. My name is Leya Elijah, and it is my honor to be with you all this evening. So I am here to share a little bit of my story. I am the founder of This Is What a Fighter Looks Like, which is an organization and a social movement that I launched in 2016 as a result of my blood cancer diagnosis. I was diagnosed with chronic lymphocytic leukemia in June of 2015. Prior to my diagnosis, I was pretty much healthy for the most part. I first began to experience fatigue that I just could not shake. And fatigue is not being tired when you are a blood cancer patient or a survivor. So it was not just go to sleep and take a nap, as most people assume that we can just do. How I wish I could just take a nap, which I desperately needed today to get through today. Fatigue is, it's like a heavy weight. It can often be painful if it's gone too long and untreated. And so it was something that diet didn't help, vitamins didn't help, protein shakes didn't help, meditation didn't help. And so I knew that I needed to seek professional assistance with it. I began to experience frequent episodes of dizziness and lightheadedness, which began to affect my balance and my coordination. And being a choreographer, a dancer, a director, that wasn't good for my life. I needed all of those things. And also being a plus size model, being a motivational speaker, spending most of my life in 4 to 6 inch heels, sister needed to be able to walk and have some balance. So off to the doctor I went. I had to advocate for myself. And I often tell people this because my first doctor honestly did not listen to me and dismissed it as, number one, I was just getting older. I was close to 40. I was overweight. Don't you just hate it when people just dismiss it as you just a big girl? And so I hated that. And they often do it to women of color. And so I had to find a different doctor. And I thank God that my next oncologist stopped and actually listened to me and paid attention to me. Remember that this is just your one life you have to live. And while they're living theirs, you have to live yours the best way possible. And so we began to do the work that was necessary, which of course meant blood work, more blood work, and then blood work some more. My white blood counts were not where they needed to be. Honestly, my red blood counts were not as well. And so that started us on our journey. And so we began treatment. The first thing that I had to do to effectively be diagnosed was have a bone marrow biopsy, which is diagnosed as hell, but it is necessary. It is painful, but you have to get it. And it was important to me. I've had more than one in the last 7 years, but it was necessary for me. Once I was officially diagnosed, we started on a treatment plan. I started off as W&W, which is watch and wait. After a year though, I did need treatment. And so we started on chemotherapy. I chose what was best for me, and I can't reiterate this enough. Do what is best for you. I faced my mortality to find out how to live. I found out that I was on this earth to help so many other people. I began to not just fight for cancer, but also for other people. I fought for young people. I started my organization for This Is What a Fighter Looks Like, but I also founded PD Community Arts Team, which was my performing arts organization. And I wrote, direct, and produced 10 musicals working with amazing young people in my community. And it's been my life's dream since I was 4 years old. I started writing one of my books. I began to fight for domestic abuse because I'm a survivor. I began to fight for sexual assault abuse because I'm a survivor. I launched my podcast with my two amazing sisters, and it's been a dream come true just to sit and show people that these two women who helped me fight, we just get to share our stories, and it's been a wonderful thing. So I began to find out that when I could have thrown in the towel, it was best to pick up that towel, dry off, and keep going. So the most important thing I could tell you as I close out my story, which I could go on and on with, is to never stop living. It's just a diagnosis. It's not the end of the world. So to all of you all who are dealing with blood cancer, let me tell you, never stop living. Get up, show up, and continue to show the world this is what a fighter looks like.
That is incredible. Thank you so much, Leya, for that amazing testimony. I just am blown away by your testimony and the sheer mass of things that you have done in the time that God has given you, despite this diagnosis. I definitely have the honor and privilege of introducing Dr. Woods, who is a hematologist at the Food and Drug Administration within the Division of Hematological Malignancies or blood cancers. She graduated with BA in psychology from Spelman College right here and completed her medical doctorate at the University of Chicago Pritzker School of Medicine. She then completed her internal medicine residency at Yale New Haven Hospital and completed her hematology and medical oncology fellowship here at Emory University. Her current work is in research on patients with blood cancers, including acute and chronic leukemia, myelodysplastic syndrome, and allogeneic stem cell transplantation. Dr. Woods is board certified in internal medicine, hematology, and medical oncology, and is a member of the American Society of Clinical Oncology and the American Society of Hematology. Let's welcome Dr. Ashley Woods.
Thank you, Dr. Marsh, for that introduction. So good evening. My name is Dr. Ashley Woods, and I would like to thank the organizers for giving me the opportunity to speak to you all on the Community Guide to Blood Cancers with a focus on CLL. So I want to take a step back and sort of talk about what is a blood cancer. And a blood cancer affects the production and function of your blood cells, which is made in our bone marrow. And our bone marrow is located in our two hip bones, and then some is present in our chest bone. Stem cells in your bone marrow mature and develop into three types of cells, and they are white blood cells, red blood cells, and platelets. For blood cancers, there is an overproduction of one of those three types of cells, and that prevents your body from doing its normal functions, such as fighting infections or stopping life-threatening bleeding. So today I'll be focusing on leukemia, specifically chronic lymphocytic leukemia. So just a little background, about 200,000 people will be diagnosed with a blood cancer in the US in 2020, or were diagnosed. And then since 2010, the FDA has actually approved over 20 new drugs for leukemia, lymphoma, and multiple myeloma. However, despite all of these recent advances for blood cancer, there's still disparities that exist between white patients and minority patients, with minority patients not really benefiting as much from these new drugs and still having inferior survival outcomes. So as far as CLL/SLL, CLL accounts for about 25% of new cases of leukemia. The 5-year overall survival for CLL or SLL is pretty good at 88%. When we say 5-year relative survival, we mean the odds of someone still being alive at 5 years after their first diagnosis. So you have an 88% chance of still being alive at 5 years if you're diagnosed with CLL. And this is compared to acute leukemia, where the overall 5-year survival is about 30%. So as far as CLL and SLL in Black patients, so we tend to be diagnosed at a younger age, in our early to mid 60s. And studies have shown differences in disease biology between Black and white patients, with Black patients presenting with more poor risk disease features. And we have a shorter median overall survival time compared to white patients, where a white patient with CLL typically live for 9 years on average, and for Black patients at 7 years. So as far as staging CLL, there are 5 stages. So we typically consider stage 0 as low risk, stage 1 and 2 are intermediate risk, and we consider stage 3 and 4 as high risk. So SLL is just like CLL, except instead of being in the blood, it's just in the lymph nodes. So some of the signs and symptoms of CLL, and Leah had already spoken to this, but most patients of CLL are usually asymptomatic and it's usually picked up on routine blood tests. But there are a handful, about 5 to 10% of patients that will present with symptoms. And we call these B symptoms, and this is not specific to CLL or SLL. This is for any sort of cancer. So this could be breast cancer, lung cancer, colon cancer. These are the B symptoms that we typically see. And then specifically for CLL or SLL, you can have these enlarged lymph nodes, and you can also have some abdominal pain from either enlarged spleen or liver. So you've been diagnosed with CLL or SLL. So now what are the next steps for you? They're going to take a lot of blood when you're first diagnosed. And so they're just checking, for your white blood cell count, your platelets, and your red blood cells. They're also checking how well your liver and your kidneys are working. They're also doing other tests that sort of help us stage a patient with their CLL or SLL. For CLL patients, you will get a bone marrow biopsy, and those are painful. We do give people lidocaine to sort of numb up that area, but there still is some discomfort with that procedure. And then for patients that have SLL, we typically do a CAT scan of your chest, abdomen, and pelvis just to see if there's some enlarged lymph nodes that you can't feel or that you can't see. So then the main question, once you're diagnosed with CLL or SLL, is if you should treat or if you can do this kind of watch and wait approach. So when you see your doctor and they have all your blood tests back, they're going to stage you. And then the main thing is they're going to look and see if there's any indication for treatment. An indication for treatment are some of those B symptoms that we talked about, where you're having the severe fatigue, you're having the night sweats, you're losing weight. If you're having some pain from your enlarged spleen or liver, or if your red blood cell count or your platelet counts are getting too low, then those would be indications for treatment. But if you're not having any symptoms, regardless of your stage, we can do what we call a watch and wait approach, where we just monitor you and you come in to see your hematologist about every 2 to 3 months. We check your blood counts again, we check how you're doing and to see if you have any symptoms. And if you don't have any symptoms, then we don't need to treat. If you're doing fine, you're still able to work and do all of your daily activities, we just continue to watch. Treatment is really going to depend on your own disease biology. And one of the main things we're looking for is looking at chromosome 17. Now, every patient has 46 chromosomes. I don't want to get too deep into this, but we're specifically looking at chromosome 17 because there are some patients who have cancer that are missing part of chromosome 17. And we know that some treatment works better for those patients who are missing a part of that chromosome. And so just a quick note on therapy for CLL and SLL, there are 3 types of therapy. There's chemotherapy, there's something called monoclonal antibodies, and then there's oral option too, where you can just take a pill at home. And so these are some of the treatment options for first-line therapy. And I'm not going over all of this, but I just wanted to show you that there are several treatment options. And again, each treatment option is going to be specific towards the patient. They're going to look at you as a whole, like how active are you? Do you want to come into the infusion center to get treatment, or do you just want to go home and take pills? These are all the things they're going to be looking at. And based off that, they'll pick a treatment regimen that's good for you. And then there are more treatment options. So say if the first line therapy doesn't work, you need something else. You can see there are more treatment options for subsequent therapy. And again, these are for patients who aren't missing that chromosome 17. And these are treatment options for people who are missing a part of chromosome 17. Again, they also have a lot of treatment options available for them, but they're a little bit different from treatment options for people who aren't missing that part of chromosome 17. So that's why it's important to sort of figure out what's going on with your own specific disease. So I just want to do a quick word about clinical trials. So the clinical trials, they're meant to evaluate the effectiveness and safety of new drugs. For trials that are for first-line therapy, so people who are just diagnosed or just getting their first treatment options, patients will always get at least standard of care treatment for their disease. So those clinical trials are usually standard of care therapy will be one arm, and then the other arm will be standard of care therapy plus a new drug. But everyone in a clinical trial for first-line therapy will always get standard of care disease. And Black patients are historically underrepresented in cancer clinical trials. We make up about 4 to 6% of patients enrolled in clinical trials, which is below the amount of cancer patients that are African American or Black. So just to conclude, so about 20,000 people will be diagnosed with CLL and SLL annually. It usually occurs in older patients. You don't necessarily need to start treatment immediately upon diagnosis. And there are different treatment options available, and they'll be dependent on the patient preference and their biology of the disease. And then Black patients on average are diagnosed at a younger age and have more high-risk features. And these are just some patient resources. There's a Leukemia and Lymphoma Society. There's a National Comprehensive Cancer Network guidelines for patients. And that's not specific for just CLL or any blood cancer. That's for any cancer. They have information for patients for any type of cancer. And there's also the CLL Society.
Well, that concludes our session. I would like to thank both Dr. Ashley Woods and Leya Elijah. Thank you so much for sharing your testimony, Leya, and thank you for educating our community, Dr. Woods. I'll turn it back over to Azizi.
I also like to thank the panelists, especially our speaker, Dr. Ashley Woods. That was a very informative presentation. And also the absolute heartfelt story by our patient ambassador, Leya Elijah. I want to also thank our co-host, the National Coalition of 100 Black Women, Metropolitan Atlanta Chapter, and our sponsor, Lilly. And then all of you participating in this program this evening, we appreciate you taking your time out of your evening to learn about blood cancer. Thank you so much.